Let's listen to an expert doctor, MD Dr. Sudhir Sethi from Dr. Sethi's Heart Center, Jalandhar, for hypertension in young population along with coronary artery disease and higher heart rate. Can be sure of happy heart?
I am Dr. Sudhir Sethi. I am a senior cardiologist practicing in cardiology for the last 45 years plus.
Dr. Sir, how do we define hypertension and when should we conclude that the person has hypertension?
You see, hypertension as such is a very, very common disease. Almost 80 to 90% of people over the age of 60 have hypertension. It occurs in younger people too. Now, what we consider for the younger group is they have a blood pressure of 130/90 plus. It is hypertension. But the larger group of patients who have hypertension are the ones who are elderly people, that means over the age of 45. And in them, the upper blood pressure, that's the systolic blood pressure, if it is more than 140, I would consider those patients need to be careful and have a lifestyle modification. Beyond that, they should be taking medical help in terms of medicine. With blood pressure medicines, the blood pressure should be lowered to 130/80 or below. Also to remember that when you have blood pressure, you may have comorbid conditions like diabetes or high cholesterol. So in those patients, added anti-cholesterol medicine like lipids should also be added. You also need to remember that the blood pressure has a genetic predisposition. If you have hypertension in your family, your bloodline, father, mother, brother, or any other close relative, then you're more likely to have hypertension than otherwise. Other important factors are if you're overweight, if you consume too much of salt, if you don't have a proper lifestyle style of living, you don't exercise, your abdominal girth is more, you're likely to have hypertension, which will not only be hypertension as such, it will also cause complication. The other name for hypertension is silent killer. So remember that when your blood pressure is high, you will not know unless you get it checked. You must get it checked on a regular basis. If you suspect you have hypertension, must get it checked every 15 days. And if over a period of 3 months, if you have made your lifestyle changes and your blood pressure continues to remain above 130/90 for younger people and 140/90 in the more elderly people, you must take medications. Don't leave it too late because the hypertension will always cause organ damage, specifically the brain, the heart and the kidneys. So remember to take your blood pressure checking regularly and sure if your blood pressure is not under control, you should control it. And you must also remember if you have a genetic predisposition, you are more likely to suffer from hypertension than otherwise. It's also a silent disease, you wouldn't know. So the numbers are important, but you need to check it on a regular basis for a few times to know that you need to take medicine lifelong.
Doctor, can high blood pressure be completely cured?
Hypertension is a disease in which your arteries have got hardened. So once they have got hardened, there's very little chance that you will reverse it. Yes, you can reverse it if you're overweight, if your sugars are not under control, you have high cholesterol, you have not been exercising. If you make a big change in your lifestyle, you sure can get off the blood pressure medicines. And if you continue to have a good lifestyle modification, you remain healthy, your weight is fine, and your other parameters are well controlled, you probably can get off the blood pressure.
Has there been a recent increase in the incidence of hypertension and heart attacks among young patients? If yes, what could be the underlying cause?
Definitely, there is an increase in the incidence of hypertension in India in particular, because we have a lifestyle which is very aggressive. People are running to work, spending time more at work, not eating the right things, not exercising enough. Now, there are areas in the world where hypertension does not occur. These are very small areas. And these are the people who eat the right things, lots of vegetables, lots of fruits, and they remain slim, and they also eat in a particular way in which there are no salts and pickles extra. They eat less at one meal. They skip meal also. These are the people who may not have hypertension. But in India, we find that the incidence of hypertension has gone up maybe 2 to 3 times. See, there are minimum 300 million patients who are suffering from hypertension. The other important thing about hypertension is that only 1/3 of the people who are out of the 100, only 33 will know they have hypertension. And out of the 33, only 10 will take the medication and out of those 10, only half of them will be actually brought their blood pressure down to the real level. So the first thing is awareness, and second is controlling it adequately. But the incidence of hypertension has gone up as the incidence of diabetes has gone up. As the incidence of hypertension is the number one killer in the world. I repeat, it's the number one killer in the world. It kills you by causing stroke, it kills you by causing heart attacks, it also causes kidney damage. So important to understand hypertension is a silent killer. It's creeping up in our society. It's important to keep a check on it, and it's important to remember that it doesn't cause any symptoms, and therefore people don't treat it, and or adequately treat it. Remember to take the target number that needs to be treated: 130/90 and below, and 140/90 and below. So it's important, as you age, your chances of having hypertension is very, very high. Treating hypertension is a very helpful way. You prevent your main target organs, give them protection: brain, heart, and kidney. So please try and remember, check your blood pressure. Blood pressure is present in the society. Almost 80 to 90% of people over the age of 60 have hypertension. And hypertension is a disease which has comorbid conditions. So it's important that you must understand that you may have diabetes and you will develop hypertension. You have hypertension and you will develop heart disease or kidney disease. So it's important to keep a check on all that. So the most important part of it is to be aware that you have hypertension. It is increasing in our society. And the second thing is to remember to do the lifestyle modification. If you are unable to control it, please take medications for it. And by controlling hypertension, you are also controlling your target organs, that is the heart, brain, and kidney. So the important aspect is hypertension is increasing at a fairly alarming stage. The other important thing is, with the help of medication, people are living longer. When you live longer, your upper blood pressure, that's the systolic blood pressure, that is bound to increase. And that is the one that actually causes most of the damage. So it's important, if you are elderly, you would be having underlying hypertension, it's important to take medications, control it. Don't say that I don't have any symptoms, therefore I don't worry about this blood pressure. You should worry about it. You should treat it. I don't think you need to worry, but you need to treat it. And that will help to protect your target organs.